Welcome to Health System CIO's interview with Jason Taule, CISO at Luminis Health. I'm Anthony Guerra, founder and editor-in-chief. Jason, thanks for joining me today.
Pleasure to be here.
All right, very good, Jason. You want to start off by telling me a little bit about your organization and your role?
Well, my organization, we're a healthcare provider system. Most people call them hospitals. We're a regional system throughout the Mid-Atlantic. We're a bunch of hospitals that came together shortly before the lockdown. We provide care for people throughout Maryland. That's what we mean by the Mid-Atlantic. And I am the internal CISO. Um, my job, as we'll talk about today, is largely to inform the conversation. So the men and women who make risk-based decisions every day, saying yes or no to things, do so fully informed, fully aware, right? It's okay to accept a risk if you know about it. Not okay to accept one if you're accepting it by default because no one's made you aware that it exists.
All right, perfect, Jason. So I was at your session, you spoken at the Chime Full Forum, and we got an opportunity to chat for quite a while afterwards, which I really enjoyed. Um, Different topics, and I learned about your career, which was very interesting. Sounds like you've had some very interesting roles at all kinds of different places and sort of seen security. I guess the consistent thing is cybersecurity, but seeing it from in different industries and different angles. So I'd love for you to take the listeners a little bit through some of your experience.
Sure. Well, I don't pretend to be the guy. I'm probably one of the guys of cyber, and I say that for no other reason than the accident of the date of my birth and where I was and where technology was. I wound up graduating from my undergraduate and going into the workforce in the mid to late 80s. The Computer Security Act had just passed in 1986. I went to work for Booz Allen. They handed me a copy of the Rainbow series and famously said, "Stay a chapter ahead of your clients." Right? I did work in the Intel community. I did work building security programs for several of the um, federal departments. A couple of years later, people may remember that a gentleman by the name of Robert Morris from Potomac, Maryland, let loose the internet worm. He didn't necessarily intend it to have the devastating consequences that it did. But as one of the first people on the internet, I promptly got shipped off to Carnegie Mellon, where I helped the folks at DARPA create the first computer emergency response team, what's now been assumed underneath Homeland Security. So it's just basically me being in the right place at the right time with the right background. I think luck, what is it? Luck favors the prepared is the adage. I spent a few years there. I went off and formed the consulting practice around cyber for one of the big consulting firms. Spent roughly the first third of my career consulting. Didn't expect it to take as long as it did for me to find a client that liked me and I them, and I became their CISO. But that's kind of what happened next. It took about 17 years for that to happen. Um, Simply because cyber hadn't evolved to where it is right now. Now it's a common vocabulary term. It's a common topic amongst boards and leadership. And just as we do with the rest of the C-suite, which is essentially a division of the risk pie, right? You got general counsel dealing with legal risk. You've got your CFOs dealing with financial risk. So why wouldn't we have somebody talking about information risk management and compliance and other related issues? I got recruited away and went to High Trust, which in healthcare is the gold standard for providing third-party assurance. We all do business with one another. I need to know that if I'm going to let you into my environment, I can do that without you introducing risk to me and my customers or the patients in this case that I get data from and vice versa. That was a great opportunity for me to help address some of the pain points that I had had. Um, my work was basically work at several large systems integrators like General Dynamics and Computer Sciences, where I was the inside CISO, helping the systems that we built for our customers get accredited and remain free from compromise. That's what made me one of the first people to earn the high trust certification, which is why I went there. So all those pain points were things I was trying to solve for. Did that for a couple of years. And then in this last third of my career, I'm kind of giving back. I'm a virtual CISO. I support several different organizations because I think that it's really important that organizations get this right, especially in highly targeted sectors like healthcare.
Excellent. Thank you for that, Jason. All right, we're going to go through some issues sort of one at a time, and I'll just get your thoughts and we'll go from there. So one
Okay.
of the things we discussed that you mentioned, the importance of identity. Uh, you know, we know that it's no longer a perimeter situation and keeping folks out. everyone's going to be in and all over the place, and you just have to know who they are. We've seen that company Clear starting to pervade a little bit in healthcare. I guess I don't know if you have any thoughts on that particular dynamic, but we know everything seems to be about identity. There's other major trends in terms of running a shop and what you should be focused on, but let's start with your thoughts on identity.
So a number of vendors have started adopting the adage that identity is the new perimeter. Now, I get what they're saying. They're saying because of the change in what once was a hard perimeter and our move increasingly to the cloud, that because of that, we have to get identity right. Now, there's truth in that without question. But what I want to call shenanigans on a little bit is that this is not a new issue. Identity has been the very first issue that we ever needed to get right. A number of years back, I was traveling to Morocco, and in North Africa, there were some of the earliest, I'm going to call them banks. It's not necessarily the right term. It was more of a fortified granary where people stored their nuts
Mm.
and their oils, but they also stored jewels and tablets and documents, right? Now, mostly they were trying to protect it against either a drought condition or bandits or rival tribes. So as long as we've been organized as people, we've had certain things that we wanted to keep secure. And if you gave me something to keep in this bank, in this vault, now you show up and ask for it back, I've got to get your identity right. So this is not a new issue. Now, the problem is we didn't really get it right since the time of knowing one another. Right back when we were a small village, you walked up to me, I knew you, I recognized you. We had that history. How do we do that now? So hospitals are challenged because everything that we give access to is largely sensitive information, and we got to make sure we're only giving to the appropriate people. Otherwise, we got all sorts of problems. How do you do that in a world where I can go online? The thing that we mentioned at the Chime conference was talking about Dread, which is the deep web version of Reddit, and pretty much for your audience, if they don't know, for every legitimate marketplace that's available on the web, eBay, you name it, there's an equivalent marketplace with a very different product portfolio, right? Um, so if you want, you can go online and you can buy what's called a Foles package. It's a name-matched driver's license, credit card, and Social Security document. So I show up day one for employment, and we go through the I-9 employee verification process, which is what all of our downstream identity vetting is typically based on. And how do I know that I can get that right, especially when you're presenting potentially counterfeit documents? So that's issue one. Second, increasingly, we don't even do identity vetting in person. We do it online, right? How many of us have been prompted with a need to access an application, a platform, something that's running in the cloud? What do they ask you for? Well, tell me your name. I type in Elon Musk, and that second thing it says is give me a phone number. I put in my phone number, and I will promptly get a one-time password sent to me, and I echo that back. And now I've proved to that application owner that I'm Elon Musk. No, I didn't prove anything of the kind, but that's what many people mistakenly accept as identity vetting. So in this world where increasingly we are operating at a distance from one another, we got to get that. That's a question of integrity, and how do we do that? Well, to your question about how do you do that in a healthcare situation, I don't know that you're going to get identity perfect. It has to be good enough. And if you're the CISO, your job isn't to make that decision. Your job is to inform the conversation, right? It's not the only job, but it's certainly amongst the primary functions of a CISO is to help inform that conversation. Are we okay with our current procedures? Probably. I'm not really worried about a clinician trying to fake their way into my system with fake counterfeit credentials. I'm not worried about that, at least not for us. Different environment, different situation might be different, but mostly I'm worried about at a distance. How do we do that, especially if they want to call the help desk and say, I need to do something that we would consider to be risky. I need to update my phone. Um, Here's the thing. If you lose your phone, and it's happened to all of us, you've accidentally left it behind, you've had to get a new phone. Most of us get a new device. We don't get a new phone number, right? So
Mm.
if the help
Right.
desk is directing, or you would have to contact the help desk to get that set up, you're directing your one time, your duo, your octa, whatever it might be, to that phone number, not a new
Mm.
phone. Why are you getting a new
Right.
phone number? So
Very
when it's
rare.
something that now it's possible that somebody is doing that. Okay, but that's a very risky case. So we're going to have to step you through some additional things. And for us, the way we've adopted the protocols is if it is risky, you're going to have to get on camera. If you can't get on camera, sorry, we can't accommodate this remotely. Get on camera and get your badge, right? And mush it into your face. You know why? Well, you got to prove you're not a deep fake. It's shockingly easy how quickly and with tools that are available on your phone you could create a deep fake that could potentially fool someone if they weren't appropriately attenuated to the issue and if the company hadn't. One of the other things the CISO has to do, in my opinion, is you got to give the people that are in these positions to make these calls the high cover. They know they're not going to be the one that gets blamed if there's a customer service impact. We're all so customer service oriented. We want to make sure everybody has a positive experience, but sometimes saying no can create a bad experience. I have to make sure that the folks who are taking that frontline call, our help desk folks, whoever they may be, they know however they want to phrase it. Sorry, it's above my pay grade. I'm not at liberty to do what you've asked. But it's okay because we've got a security team, we've got a security officer. They're available 24/7. Give me 5 minutes, we can set up a call and we can work this out. So again, in this case, where you have these identity issues, we have protocols, we have processes, but if the request is riskier than that, then we have protocols that people can follow as well so that we can make that decision and we don't leave it to chance. Bottom line, nobody talks their way in.
Very good. All right, let's go into these a little bit. From what you're saying, uh, it sounds like the CISOs need to be involved in informing some of the policies that are developed in different units. Now, the help desk is going to be sort of more quite under IT, right? They're the IT help desk. You're going to be able to work fairly directly to get those policies in line with what you want to see done. And then what you were saying is if you follow the policy as it's written out and some surgeon goes nuts and starts screaming they want you fired, I got your back. If
Right.
you've done right, you've
Correct.
followed the
100%.
policy, don't worry about it. Do just follow the policy. So that's fairly direct. You're working with that type of a policy. I was thinking when you talked about hiring, that's going to be an HR function. So they're going to manage that. They're going to be doing the interviews. And I'm wondering, how do you, when you see a security issue in another department, so you know hiring can be an issue, and you want to inform the policy. You want to make sure the policy takes some things into consideration. Do you reach out and start asking for meetings and say, want to meet with whoever's in charge of HR and want to discuss and help consult and partner, that type of a thing? Like, how do you make, because they may not even realize certain concerns you have unless you reach out, and that could apply to many different areas.
When I say inform the conversation, that's exactly what I'm talking about. Any major business decision is likely to have a risk component to it, right? That's why it's a major decision, right? If it didn't carry some risk,
Right.
anybody could make it. First, you have to promote awareness of what those risks could be. I don't think security should be driving the conversation. What I think most organizations should do is articulate what your objectives are, your business objectives, right? We have these, I want growth, I want efficiency, whatever, they might be. And this is 2025 going into 2026. I can't imagine business objectives with a business strategy that aren't supported, at least to a certain degree, by IT. So there's going to be an IT strategy to support the business strategy. Once we have that in place, now we can have a conversation and we can invite the appropriate stakeholders to the conversation. If we want to do this way, these are the risks to which we're going to expose ourselves and our partners and our customers and our patients and their data. Now, for all of those risks, there are things that we can do. We call them controls. We borrowed that language from the financial sector because it's not just protecting money, right? If anybody that doesn't understand it, we know how important it is to protect money. But if you're debating the importance of protecting data, think about it. Money isn't coins and paper in a bank vault. Money is data. And by the transverse property, data equals money. So if data is involved, especially if it's sensitive, we need to have a conversation. When we do these things this way, these are the risks to which we expose ourselves. We can implement controls to buy that risk down to an acceptable level. Now, there's a spend for that. Spend in terms of acquisition and maintenance and all the IT stuff, but there's also a spend in terms of the impact on operations. It's likely going to be an extra click or two. It's going to slow us down in terms of however long it takes us to do things. We've got to make sure that management understands what the impact is and has, again, high cover for security and IT. And then we educate everybody, and then everybody who's affected by that also understands. Because if we don't, what are they going to do? Well, they're going to try to work around it. Well, that's the worst possible outcome, right? Because now we spent money. We didn't address the risk because people are working around it. We just wasted money. So having that conversation, if management says, well, I don't like that risk, but I also don't like the control, We could iterate on that. There's more than one ways to do it. There's good, better, best, right? Maybe we take a lesser option, maybe as opposed to something that's more draconian. We might even say, you know what? Maybe we don't achieve the objective through that IT strategy. As an example, I remember a number of years back when the world kind of woke up to data localization, right? We want to use the cloud, but we're a multinational or a company that's got operations in the EU, for example. The data that we collect from citizens of the EU, even though it'd be highly efficient to put it all into my big data lakes and everything else here, I can't. I got to keep it there in the EU. Well, if the goal was to grow our business by expanding into a new market and then leadership didn't understand that, that would be an example where security could say, here's a risk. The control is we've got to keep it there. We can do it. Maybe you're a Microsoft client. You say, Microsoft, let's tag this data under an E5, and we tell them, and it stays in the Microsoft cloud in the EU. But there's costs associated with that. If they say, oh, we don't want to do that, well, maybe then we grow a different way. We don't grow by going into EU. So there's that iteration, both on the solutions, on the strategy, and maybe even on the initial objectives themselves. And that's really the best conversation is when you are involved with the key decision makers. You're not there
Wow.
to decide yes or no. You're there as a consultative model to help inform the conversation. Think of it this way. There are corporate attorneys who have a very different job from a plaintiff attorney that's going to the court. Their job is to help the business find a way to do whatever it is they want in a way that's respectful of the law, right? Same thing here. How can we CISOs enable the business to do what it needs to do in a way that doesn't put us or our patients or their data at risk?
That's really, really good. I thought I thought it was extremely interesting. And it makes a lot of sense. It's how in that discussion that IT and IT security is having with business leaders, you could ultimately get to a place where the business strategy needs to be changed, right? Because the implications, the feedback from IT is you can't really do what you think you want to do, or it's not going to work the way you want it to work. And it's you get to the point from a business point of view where it's no longer worth proceeding with that
Right.
strategy.
Now, that's one of the reasons the CISO's got to fight to have a seat at the table. Now,
Yeah.
when I say that, I don't necessarily mean that figuratively. You just need to be in the room where those discussions are happening. Even if you're sitting as a fly on the wall, or not at the main table, you're at the, I picture the big round UN tables where the major countries are sitting there, and they've always got the couple of technical geeks sitting behind them that can empower the
Standing
politician with
standing
whatever.
against the wall.
Yeah, so be one of those people. Again, your organization doesn't need to have the cyber expertise that you as the CISO or that your team brings, as long as you're involved in the conversation.
Yeah, I always thought that and maybe it could be from a security point of view, but from other angles, especially around what EMR an organization is on, it's come up in discussions around M&A where, you really need to involve IT early on in those discussions because there could be implications that would make a merger not quite as appetizing as you thought it was.
So let's pull on that a little bit because sometimes there is pushback and organizations don't always want to involve the security folks in the conversation. I think they have the misperception that we're going to say no to the deal. No, no, no. Um, I'm going to say that nobody wants to buy risk. If you're the acquiring party, let me help you understand what it is you're buying. If I say this is full of risk, I'm not saying don't buy it. I'm saying go in eyes open. Get a better price. Reduce the
Right,
offer because to compensate for the risk that you're going to have to accept.
right.
There's a TV show, I don't know what it's called, but it's on one of the home HDTV or whatever the show the network is. Hey, you got this house and you want to sell it? Boy, those are really dated avocado colored appliances from the 60s. I think you need to upgrade those to modern day stainless steel, whatever the fad of the moment is. If you do that as a small, modest investment, you're going to get a better price, right? So you can do it on
Yeah.
the other side as well. You should understand and be talking to people early. What is it that buyers find value in? I've had the good fortune to be through 7 exits. And the very first one, cyber wasn't part of the conversation, but from the last six, cyber was absolutely part of every one of those conversations. What are we buying? What's risky? What do we want to make sure that we know about so that we can get that price accordingly?
All right, very good. Let's move on to issue two. This is the one that's got lots of CISOs interested and nervous, the whole AI
Oh my.
discussion. We've got a couple layers here. We've got sort of old school machine learning, which is sort of the original AI that's kind of been around forever and and I guess it's not that big a deal. We've been dealing with it forever. We've got Gen AI, which is maybe 3 or 4 years sort of old of sinking into the market and being used a lot of. That's the big LLMs. And now we have agentic AI, where it's going to be doing things theoretically on its own. Um, there's different levels in different areas that's sort of making inroads. You've got Gen AI, it's sort of administrative areas right now, revenue cycle for the Gen AI, and then the agentic AI, very cautious around clinical areas to get these human in a loop issues. Obviously, lots of cybersecurity issues there. So I'd like your thoughts on all those kind of dynamics from your point of view.
All right, let me start simply and then we can dig deep. For most of us, especially in healthcare, the benefits of AI, and again, as you said, I'm talking about generative, agentic, or other forms of advanced AI, not the basic knowledge-based, rule-based things that we've been using for years. The benefits are so compelling that there's no way you're going to say no to them. Let's just start with that. That doesn't mean you go crazy and use it without controls. That's not defensible either. So therefore, if we approach this as just the latest instance of what most of us will call shadow AI, right? We know about and can control the IT that we are responsible for, that we're accountable for, that we initiate, that we help the company with either of our creation because we're managing the
Right.
IT infrastructure transparent to the business, or the business have come to us with a need and we've gone out and fulfilled it. All of that stuff we know about. That stuff, can't manage what you don't know about, right? The problem is if your culture or if your organization, or because of the limited perimeter, you have the ability, a person in your organization has the ability to go out and contract with a cloud provider, right? That's shadow cloud. Now, the same thing with shadow AI. Now that AI is being embedded into everything, that's a problem. So, if you look at it in that context, there's nothing special about AI. It's just another instance of IT I may not know about. So, the very first thing I need to do is learn about it. Inventory. I need discovery capability. I need centralized oversight. Now, the challenge is, like anything else, the tools that we rely upon to manage other instances of shadow AI may not know about AI. I'm sorry, shadow IT may not know about AI yet. Okay, well, you can go and buy and find specific AI, shadow AI tools to help you govern it, or you can talk to your existing vendors who deal with shadow IT and say, I don't want to have to buy another tool. Right? Most CISOs want fewer tools, fewer panes of glass, fewer consoles. What are you doing? It is on your roadmap. Where is it? If not, it better be, or I'm going to start looking elsewhere. Right? So you're telling them. I think a big part of the whole thread of this podcast I want to emphasize is we in healthcare, we CISOs have to be more. I guess the word is demanding of our vendors and our partners. The many in cyber, this is, I'm not the first one to say this. Many of us jokingly say that Microsoft is the reason we all have jobs, right? And I'm not saying Microsoft's bad. I'm saying, had we been more demanding of Microsoft, I mentioned the Rainbow series at the start of this conversation. The Orange Book talks about how to build a trusted operating system. Microsoft is not a trusted operating system. That's not a disparagement of Microsoft. That's because we didn't ask them to build. We didn't demand and we weren't willing to pay for, right? Remember, all of these things, it's the same thing when we started saying to the initial cloud providers, you need to be responsible for security. And they went, no, we're not. And hang on a second. Now, of course, they all do. They've got all these capabilities. In fact, they've learned that they could generate revenue by helping us. And in many cases, smaller organizations can get better solutions, better capabilities in the cloud than they may be able to get on-prem. Certainly at a better price point because of the economies of scale. Same thing with AI, right? So learn about it, have something to discover it, and have some centralized oversight. Now that you know what you have, then you need to do two things. The same two things you do with any other IT. You got to have control over how you use it, and you got to harden the thing. So the hardening and runtime protections, I think most of us understand how we would do that. There are some horror stories about AI and how it got wrong because we didn't anticipate that it was going to have that problem. Because again, we are, and this isn't we, I'm talking about the developers of AI, are over their tips. There are so many examples of things that we're doing without being ready for it. The fact that poetry or anything that has artistic expression can be treated differently by the AIs in terms of their guardrails, such that it will ignore things that you tell it to do. What's special about rhyming or iambic pentameter or whatever other characteristics poetry has that it shouldn't be subject to the same guardrails? Well, it's just a question of most of us are beating away, most of the bad guys are beating away at to try to figure out how we can get around the guardrails. Like we said, our workers would do, and when security implemented control, it's no different here. The problem is we're not the ones trying to work around it. We're the ones relying on them to have good guardrails that can sometimes be nullified by the actions of people. So that brings us to the third area, which is input detection and guardrails. Think about it as essentially a firewall for the prompts. So here the concern is if you are definitely engaging with an AI vendor, that's not shadow AI. That's just regular AI. You should be reviewing the terms of the contract. Minimally, you should be making sure that you have the ability to decide whether or not and to what extent your data gets included in the training of the LLM, right? Because we don't know. Supposedly it's protected right now, right? It's funny. I use three or four different AIs on a regular basis. Partly I use them asking the same questions because they are fallible. And if
Right.
I get consistent information across, it gives me greater reliability and less work that I have to do as the human in the loop. But I will ask it multiple questions. I will see what kinds of responses it get. I will subject it to different kinds of expectations, and I will ask them, "What do you know about me?" Brand new
Right.
session. What do you know about me? Now, it should
Right.
say, I don't know anything about you because I'm not supposed to remember anything about you. And yet, oftentimes when I ask it a benign question, it will answer it in the context of healthcare because it knows that I'm a CISO for a healthcare organization and likely want it in that context. I do, but I thought you said you weren't supposed to remember anything, and yet it does. So we have certain issues there, right? The EU, you got the right to be forgotten. Forget everything you know about me. Now, I can go in and manually take things in most of these, but I have to take the initiative to go in and delete conversations and delete results, etc. But you have to be careful that you're not doing, well, there's two issues here. The first is controlled unclassified information is what the Pentagon is behind their CMMC program, right? It's not classified, but if you take a bunch of unclassified information and put it together in the right way, you can have toxic buildup that reveals a sensitive picture. Well, the same thing is true. PHI, PCI, whatever your label is for your sensitive information, if you put a bunch of data that isn't sensitive together, sometimes I can learn things that are sensitive. So you have to be cautious
Mhm.
about that. Certainly, then, we also want to make sure if we are either through shadow AI or because of a sanctioned AI, we're allowing the people in our organization to use them to solve business problems. Hey, I got this really troubling case, and I would like you to help me understand what the appropriate course of treatment is. Here are the details. Well, did you put in details that are PHI? Are you going to remember it? Maybe you shouldn't be doing that. What can I do to support the use case to get those benefits we talked about, but do so in a way that doesn't allow our people, our users, to inadvertently put us or our patients at risk, right? And that's what I mean when we talk about input detection and guardrails. And by the way, that should be policy settable, not individual. I'm not trying to create multiple firewall rules, right? This to that. You can say this word, you can't say that. It needs to be policy based, otherwise you wouldn't be able to manage it. There needs to be some sort of basically policy enforcement engine. And the good news is there are several tools. If your vendors are interested, I'm sorry, if your audience is interested, I can name a couple of different tools that they should consider looking at. But if you do that, then I think you can say to the organization, I think we have a way. Most organizations are establishing AI policies. They probably have some sort of AI governance council. And by the way, an AI governance council, there's nothing wrong with it. But why is it specific to AI? Why isn't it just IT governance council? This is how we use tech. This is how we use data. All of those same risks are across all of those different use cases. And I'm sure there's a technology that we haven't even thought about yet that will be the next thing that we have to discuss in a governance council. Don't make it specific to IT. I mean, to AI. Make it specific to, or more broadly applicable to IT. Whatever they decide, then there's tools that I can suggest that will enable you to enforce the cultural parameters that the organization wants to operate under.
Very good. You mentioned use cases, the concept of use cases. What's the best way for IT security folks to know what are could be rapidly evolving use cases going on the operation side, on the clinical side? How do you know what they want to be able to do, for example, with these different LLMs, so that you can then secure it or develop policies around it? And then, we have around purchasing tools, we can put up um, walls and things like that through procurement and whatnot. But do we get into an area where a tool in and of itself may be fine to do certain things with, but then they may want to do other things with it that are not fine? So, we have to get pretty granular with our
Wow.
governance or our rules, right?
You asked 78 questions in that one prompt. Let me poke at a couple of them and then we can figure out which ones we want to take up. To the first question about how do we know, the simple answer is ask. Don't presume that you know anything about anything. And this is true of any CISO in any industry. I'm an expert in cyber. I'm not an expert in how to deliver care expeditiously to patients in various specialty areas. I don't understand the tools and the technologies that they need to use. What I need to do is cultivate a partnership. I don't want the business, let's put it this way. I think many CISOs will agree with this statement that the way we are judged, and this isn't just CISOs, it's typically all of IT, in a hospital setting, it's from the perspective of the clinical staff. If
Yep.
we can make their lives easier, and that's typically measured as a function of time, right? How long does it take me to see a patient and chart the account, chart the encounter from into the medical chart and so it drives billing, right? If I can do that in 15 minutes and you can help me get it down to 14 minutes and 30 seconds, that's money for the organization. Everybody's happier. Great. Now enter AI, tying it back to the prior conversation. Our business owners came to us with asks. This is great. This is the culture we want. We don't want you going to, don't, why are you evaluating the vendor? Right? That you could be potentially wasting your own time if you do that. And then by the time it gets to the contractual review process, if the lawyer says, "Hey, there's some term in here that we can't accept, we can't use it," or if I say from a security standpoint that solution doesn't meet our basic requirements, they're not complying with HIPAA, for example, or whatever it might be, then we have to get to know. Now we got to look at a different vendor. Why don't we have that partnership up front? Right? Bring your needs, and we will bring our support. Now, that gets to the second point. My mantra, and I'm going to credit Thomas Quinn from T. Rowe Price, a famous financial house here in Baltimore. He and I belong to one of the same CISO roundtables. His mantra is one I've taken to heart. Ruthlessly drive efficiency through standardization and automation. Right? Let's break that down. I want to talk about the standards part first. So if a business person comes to IT and security and says, "We have this need," in many organizations, they're like, "Okay, what do you want?" Well, I'm saying, no, we're not going to do that. We're too big. Standards. When that business need arises, we have a standard way of handling it. This is the standard application. This is the standard configuration. This is the standard whatever. Now, am I insisting that it has to be that way for everything? No, that's the standard. It's the default way that we address that business need. If you, Mr. Business Person, can articulate a need that solution won't fulfill, now we can make it our time and invest the effort to go look for something that will better meet that need. Because one of the other things that we have to address that the business owners don't always understand is that there is additional factors into the cost. It's not just acquisition cost. What's it going to take us to maintain this? By the way, if we're a hospital, if we're a 5 hospital system, you don't fulfill that medical need with 5 different tools, one unique to each hospital. That's unwanted complexity, which translates to risk. I need higher cross training for across people in order to be able to support it. It has increased total cost of ownership. When you can begin to standardize, it drives all of those things in the right direction. So that's a whole partnership, and that's how we address this when we get to the question of business needs. Now, there's another side to the third-party risk management. You mentioned you still need hooks that keep things from moving forward. Even so most of the time, my insider issues are not malicious. It's someone trying to do their job, and they're trying to do it in the best, fastest way possible. And they don't always fully appreciate the risk to which they might be exposing us or our patients and their data because they're not having the conversation with me. So to keep somebody from doing something that could put the organization at risk, we have checks in different places. So the third-party risk management process gets initiated by the contract stage. You can't go to contract. The signers, even if you have signing authority, you can't sign it if the contract isn't entered, and that automatically kicks off workflow, which is the second part of what I said, standardization and automation. The automation kicks off workflow. Legal's going to get it. Of course they're going to get it. It's a contract. IT's got to evaluate, does it fit with our stack? That's one of the biggest questions that hospitals are struggling with, right? We've got all this legacy stuff. I want to buy something new. Well, does that speak an older protocol? It better, because if it doesn't and I add it to the mix, now I've just got self-inflicted incompatibility issues that could result in unwanted downtime. It's not a hacker, but from the clinician's perspective, down is down. Whether it's an act of God and a hurricane or disc full or a hacker, down is down, right? So we've got to make sure that we're keeping the organization from doing things that could put us at risk, and it can't get beyond that.
All right, very good. So you mentioned earlier in the conversation when we were talking about the help desk and someone um, complying with a policy and someone gets angry at them and you would provide cover. I think we use you would give them cover
I cover.
of
Yep.
protection. Um, CISOs need cover too, right?
Oh,
They need cover because otherwise influential people, when they're told certain things that they can't go forward in certain ways or that it's got to be done a different way by security, by the CISO, they can try and end around and go to your boss. And so you need cover as well. Um, I don't know if is that always forthcoming? I mean, I assume it's not always forthcoming. I assume in the history of security, there have been some security professionals who found out they didn't have the cover they thought they had when the chips went down. They thought they had it, and it turns out, oh, Dr. So and so, he just called me. I know you had a problem with him, and we're gonna have to make an exception in this case, is probably the way things could get phrased. I guess that happens from time to time. I don't know if this comes down to relationship building, where that's how you try and make sure it doesn't happen. You make sure you have a firm understanding with your boss about what you're going forward with, what policies you're going forward with. And we might get some pushback here, and you might be ready to get a phone call, but here's why we're doing it. So there's a lot of education you have to do up as well to be successful, correct?
without question. Um, Again, another great compound question with lots of different parts to address,
That's
but the full objective.
that's what I do.
Let me, yeah, you do it well. Let me hit a couple of them. Uh, if you remember the TV show The Sopranos, this
Yeah.
is a pyramid structure. Now it's organized crime, but I don't mean to talk about that part. The reporting structure, right? If I work for you, the single biggest thing that I got to make sure is that you're not caught off guard, right? So if I do something and I'm able to do it because you've empowered me, I have the authority, and I'm trying to do it the right way, there still could be that negative impact that wasn't anticipated. I got to make sure I give you the heads up because that's where the high
Right.
cover starts. But it
Right.
doesn't just end with you. For things that are going to have a large enterprise, have the potential to have a large enterprise impact. Let's just say we decided, well, here's a perfect example. So one of the things that the insurance companies are starting to broadcast for your audience's consideration. A number of years ago, they learned the initials MFA or 2FA, and all of a sudden we had to have it. And if you didn't, you could expect your premiums to go up. The next initials that the big insurance companies have learned are PAM and PIM, PAM, PAM, PIM. They've learned that if you don't actually have privileged accounts, because best practices up until recently was two separate accounts, one for your daily productivity and one for privileged activity. Well, if that privileged account doesn't persist, then I can't replay it. I can't compromise it. I can't escalate my credentials to that account, which is what, of course, the bad actors immediately try to do when they get a foothold. Instead, this idea of PAM and PIM is I'm only going to create the account when I need it, only for as long as I need it. I use it, and then I immediately blow the account away. Well, if I want to do that, and we're being told that the insurance companies are broadcasting that if we don't have this soon, we can expect to see an increase in our premiums. I would like to avoid that. Or I would like to help the organization avoid that. So we're going to have a conversation. We're going to get the right stakeholders involved. And we have to obviously make sure because everyone who has privileged access is relying on that secondary account. I need to make sure I have an understanding of all of those because if I move to PIM and didn't anticipate it and are suddenly blocking someone from taking important when they need it, they can't do what they need to do to keep our systems up and running. That has real consequences, and that could result in, blame or worse to a CISO like me. So what we typically do, we use Agile at Luminis, not just for software development, but to manage our IT portfolio. So for me, I've got a 5-year plan. I don't expect it to hold up because things change, but it's a vision for what we want to do, and we're constantly revising it. That translates into 1-year plans that line up with the budget. That's also something that we brief the board on. We break that down into quarterly program increments. This is what we're going to do this quarter, right? And then 2 week sprints, and et cetera. But it's those quarterly things because I report to the audit compliance committee of our board on a quarterly basis. That's what we're using as the basis. So we've got board level visibility before we even did it, right? Because management has to say, yep, we agreed those are the right things in the right order, and that's what we're going to invest in this year. That's our highest priority items, our biggest risks, or what we need to do to enable other things. Great. That's what we're going to work on. That gives me the visibility. And then we've got change management. The single biggest function of change management is to anticipate what could go wrong and make sure that we've got back out plans. What are we going to do if it doesn't go well? Sometimes you got to push through, but other times you got to back out, right? How are we going to know? What do we have a definition of done? What are our success criteria? Who's going to be involved? It can't just be IT. We have to have the end users involved so that they validate that things still work as expected after the change, right? If you do all of that, the likelihood that as an executive you're going to be let go, I think you've managed that. Now, this is the part I said you asked a really compound question. For your CISOs in the audience, you should already be talking to your insurance folks, the internal insurance folks, your risk department, finance, wherever it's managed. You've got E&O and D&O, executives and officers and directors and officers and errors and omissions. Sorry. Are you covered? Some people have the CISO title, but they're not technically a director. So you've got to find out and get confirmation that if something happens, the organization's policies, which cover other executives, also cover you. Whether they do or not, and even if they do, you may still want to get separate coverage for yourself, cyber insurance liability coverage for yourself. That's increasingly a topic being discussed in CISO roundtables, in some of the trade rags. You may want to consider that, right? And again, we are now in a post. We had the SolarWinds issue, we had CrowdStrike, we had Uber. We've got a couple of CISOs that have been held to task, let go, encouraged to explore opportunities, maybe even doing jail time, right? You don't want that to be you. So documentation is really, really key. I'm not saying, it isn't, the focus shouldn't be about covering your butt, the CYA stuff, but you might need to do it a little bit just to make sure that it's documented. So
Right.
I think if
All
you
right.
do all of those things and operate with that level of inclusion and transparency, again, you're not supposed to be this other thing. You're part of the team,
Right.
helping the leadership manage the risk to which they're exposed.
You brought up cyber insurance. Let's talk a little bit about that. Just wondering how, I mean, it's obviously a major, major issue and totally under your realm as a CISO. You have to make sure that that gets taken care of, right? You can't be like, oh yeah, they didn't want to renew our insurance and I got to it kind of late and it's not going to work out, but I'll find us somebody. We're going to be expired in 2 days, but I'll get us someone early next month, right? So this is a big, big issue, and we do. It came up a while ago where people were having made either they were not being offered renewal, or they were being declined renewal coverage, or the rates were astronomically increased, and so they wanted to go back onto the market. And this seems like a big issue, complicated issue, moving goalposts, as you said. Now they want this, now they want that. These may be not be things that you can put in rapidly. So if you're anticipating something might be required at your next renewal, you may need to get working on it now.
Yeah, yeah.
How much of a CISO's thought process and relationship building and understanding this and understanding options and timing, how much of your brain should this be occupying?
A huge chunk. Um, Everything that you do as a CISO, or everything that you are planning to do as a CISO, as part of that, you need to be able to answer the why, right? Obviously, we're doing something. Presumably, there's a risk that we are not comfortable with and we want to get that risk down. There's costs associated with whatever it is we're going to do. There's impact to the organization. The juice has to be worth the squeeze. So
Okay.
why are you doing this? In some cases, it's our own internal risk appetite. In other cases, it's because The industry, which famously operates based on reasonable and appropriate, whatever that means, that's a whole other side conversations we can talk about. But for your audience, the short version is if you're in healthcare and 51% of the rest of our industry is doing it, you better be doing it or have a good answer for why you're not. All right. That's what reasonable and appropriate or reasonable and customary means. And by the way, it's not HIPAA. It's not the people that make the law. It's not OCR. It's not the people that enforce the law. It's not the people like you and me that have the technical sophistication to know it's actually doable. It's the 12 men and women who weren't smart enough to get themselves out of jury duty that get to decide whether something's reasonable and appropriate. And the problem is these are people that don't have current technical savvy, right? I can remember being in a situation where a juror asked for a question and the judge allowed the question. And the question was, do you mean you don't log everything everybody does everywhere and keep it forever? And the answer is no. Of course not. We don't do that. By the way, if you think that we do, and that's keeping you from doing bad things, please keep thinking that. But the point is, a juror thought that was reasonable to log everything everybody does everywhere and keep it forever. That would break the internet, right? We
Right.
can't do that. But this juror thought that was reasonable. So when you're in a situation, you don't know what they're going to think is reasonable. So you better have a good answer. So that goes to your why. Now, what else drives why? It's not just your own risk appetite or what you think might be asked of you by an audit or what are your patient's concerns. I mean, we nobody makes a decision about which hospital to go to based on their treatment of security and compliance and HIPAA. I'm in the ambulance and my appendix is about to burst. Oh no, don't take me there. But there are elective procedures or things where I care about. I mean, indirectly, it's not a stretch to say there's a strong connection between data quality, which directly affects patient outcome, and cyber, right? I mean, the reason that they go in before they amputate a leg with a big magic marker and go, this is the one that we're going to cut, is to make sure you get it right because the consequences of getting it wrong are substantial. Well, what if somebody was entering the information in the chart or it got corrupted or it was hacked and it doesn't say left leg, it says right leg, right? So, I mean, there's that connection's there. But going back to the why and tying this connected to the insurance, changing insurance requirements is a major driver. I don't want us to have to pay in premiums any more than we have to. So, what do you need to do? Number one, you should be answering the questions. If you're not, you should be reviewing the answers to the questions before they get submitted. And you have to review it through the lens of the insurance company. A lot of people don't understand how their answer will be interpreted. This is everything. I'll give you an example. A couple of years ago, I had a customer that was in the manufacturing sector. First question was after the details and the demographics, how many employees do you have? And the company answered 10,000 employees. A little bit later, there's a question that says, well, how many employees have MFA? Now, they said 2,000. Why? Because that's the right answer. Well, the insurance company says you got 10,000 employees and you've only got 2,000 that have MFA. That's a lot of risk. I'm going to increase your premiums. Now, let's see what would have happened if we had answered it a little bit differently, anticipating how that question would be interpreted. This is a manufacturing client. 80% of their workforce comes in steel tip boots, in jeans, on a factory floor. They clock in with an old-fashioned punch card. They don't even have email addresses. There is
Right.
zero reason for them to need 2FA because there's nothing that they can 2FA into. The 20% is the office worker, knowledge worker, admin, IT folks that do have access to computers. So it should have been 100% of the employees who need 2FA have 2FA. And by adding that addendum and that additional clarification, they went, oh, we get it. We're not going to charge you a premium. Again, because we anticipated how that question was going to be interpreted as being risky or not. Now, one of the
Right.
other things that your readers or your audience wants to be cautious of, the insurance companies still don't all get it right. They ask bad questions because they don't understand. They say, do you use this technology? Now, I think your audience should already know when you answer the questionnaire, the application for insurance, you have to describe what exists today. Not what you intend to do, what exists today. If you don't answer it that way, that's called insurance fraud. You lied on the application. And by the way, that can carry legal penalties, including jail time. I don't have any examples where somebody's gone to jail for that, but I do have plenty of examples where the insurance company denied the claim because you weren't truthful, right? So I'm not speaking ill of the insurance organizations. There are many that operate the right way. Many still try to make money by denying claims. They really should make their money because they've got the use of my premiums like a bank does for all of the time up front. And they can be using that money to make other money rather than worrying about how to make money by denying claims. So that's the first thing is if they say, are you using this technology? Even if I'm using for one person in my entire company, I can say yes because they asked the question the wrong way. But I'm only using it for one person. I don't even know that. In some companies, that's not even 1%. So all the other 99% that's untreated by that, they've underrated that risk. And then other times they ask a question, are you using this everywhere or all? Well, you never say all, right? Even if I'm walking into a courtroom and I got a question, is 100% of your data encrypted? Even if I got a report that says it was 100% encrypted, stuff's moving too fast. Changes happen. I'm never going to go. I'm going to cite based on this report at the moment it was taken, this is what it said, right? So, but you can't answer that way. This is a multiple guest questionnaire. You don't get to put in oral conversations, but you better add an addendum to it so that you can get that context so that they understand, right? So those are two examples where the questions themselves were bad. So make sure that you anticipate and answer it thinking about it from their perspective. The last thing I would ask your audience to do is join me. I am trying to lobby the insurance industry as best I can to change how they operate. Life insurance is a good example. You will die. And there's some people that think they should price cyber policy where you will have if you live long enough, if your operation operates long enough, you're going to have a cyber event eventually. Well, they don't price it that way, do they? And here's the reason. I can get life insurance as a smoker. It's going to cost me I'm not a smoker, but you could get insurance as a smoker. It's going to cost you more if you get smoking, if you're smoking, right? The insurance company didn't ask me to answer a bunch of questions. They just said, if we test your blood and we find nicotine in it, we're going to charge you this higher premium for that policy. Why doesn't the insurance company move away from the application process? Again, I know why, because they want to deny the claim. But they should just say, if you want our preferred premium, don't be a smoker. Here's the healthy person's policy. You've got these controls in place, and if you have them in place, you get our most preferred premium. Now, what does that enable us CISOs to do? I can take that document, I can look at it, and I can say, these are the costs that we would have to make in order to get all of those things in place to be the healthy non-smoker. And if we do that, this is the premium that we will charge, which is a reduction over this really expensive policy. Now I can have a financially driven conversation with the CFO, and we can decide if there's a return on investment. Why wouldn't we want to invest in those things? So now the cyber insurance industry is actually driving improvements in our posture, which should be their goal or one of their goals, but it's not currently one of their goals. And that's kind of where
Well,
we as an industry need to get to.
you still get driven to implement the measures or technologies if they put them in as requirements. It's a little different way than you would like to see it done, correct?
Yeah, and it's also reactive. Now let's talk about that. So if if my renewal, which is up probably, I think in the springtime is when we do it annually each year, we've interpreted the broadcast message from the insurance companies. The PAM and PIM is something that's expected. We don't currently have that in place, but we are entering a trial. We will be able to say during our next application, no, I don't have this rolled out across the entire organization. It's a big, complex, lots of moving parts. Got to get it right. But we have it under trial. We've heard you. We understand. We agree with you, and we're moving in that direction. What the insurance companies want, what the regulators want, they don't want perfect security. I want to know that you know where your holes are. I want to know that you have a plan to get there and not just a plan that you keep pointing to without making progress. You are actually making some forward progress, gradually reducing your risk, gradually improving your posture, right? So, application for insurance year over year, you don't want to answer the same question the same way multiple years. You want to show that whatever it is, we've got PAM in place. It's a proof of concept and it's covering 4%. Next year, it proved itself. It was valuable. We've begun the rollout. We've now got 2 of our 5 hospitals covered. We're going to get the next by the end of next year. That's the progression they want to see. And if you do that, because again, it's all about their assessment of you. Do you have the risk-minded behavior that's going to keep you from costing them a ton of money? Because that's really what it's about.
It's an interesting dynamic. It's like their incentive would be to get their risk as low as humanly possible, right? I mean, why not? That's their, and they don't want to pay out claims. So if their incentive is to get their risk as low as possible, they could just keep loading requirements into the policy and say you have to do this and now you have to do that and now you have to do that. All the work and all the
I
cost
hate
has
to
to be
keep
borne on
drawing
your end.
Yeah, I agree, but I hate to keep drawing analogies to The Sopranos. But sometimes the story is how it makes sense. If I can give somebody an analogy in layman's language, there are plenty of times for people that watch that show, forget the show. Anytime a loan shark makes a usuriously rated loan, a payday loan to somebody they know can't pay it back, why are they making that loan? The insurance company almost wants us to have a breach that they can deny the claim because they got my premiums in, but they didn't have to pay it out. Now, I'm
Right.
not attributing that to them. That's a really aggressive statement, but I think there's still a certain degree to which the industry, when an industry makes that much money off of not the right thing, it's hard for them to quit it, right? Look, I'm a Baltimore Ravens fan. The NFL, hell froze over last week. The NFL admitted they made a mistake in a couple of important calls in the game that affected the outcome of the game. Now, they admitted it. That was enough. They're not going to let us replay the game, and they're not going to change the outcome of the game. And it definitely means a loss. They took a touchdown, a game-winning touchdown away, right? So there's, again, it's a long, the reason it took Moses 40 years to get the Israelites through the desert. This is a change in culture, not just individually within your organization, but in the larger industry as a whole. I'm simply saying to all of to the audience that we shouldn't just sit idly by expecting it to happen. We've got to be active participants, helping explain why this makes sense, how it's better for everybody, right? Then we can get some real movement.
All right, Jason, we're just about out of time. That was the quickest 45 minutes of my life. I can't believe we're here, but let's give you a final
Oh my.
opportunity. And when we spoke, I said this was kind of my goal for to just help the younger CISOs out there. No offense, but you've been around a while, as have I, as you can see from my beautiful haircut. You had a lot of experience. There's some new stuff going on now, but they say there's nothing new under the sun, with the AI, we talked about all that. What's your best advice for a younger CISO in the health system? Maybe he's got, let's say, between 3 and 5 years on the job, sort of at the beginning of their CISO level of their career. They're in a health system. What's your best advice for them to have a long and healthy career?
Drink heavily. Of course, that's the snarky joke answer. I don't recommend that. To avoid having to reach that conclusion, the same advice I would give to any rising person: align yourself with good people, right? Find out how they are measured. Maybe it's your mentor, maybe it's your boss, right? So that they can bring you up with them. You need high cover. Relationships. You've got to establish relationships because this ultimately comes down to trust. One of the things that I've done internally, I need input from our general counsel. It's a very busy man. Everybody needs input from general counsel. I need input from other C-level executives. Before I work with them, I work with all of their number twos, all of their deputies. I've kind of got this internal risk council. It's nothing so fancily titled, just privacy officer, deputy general counsel, people in IT, and I get together on a regular basis. Just go, what else is going on? What are you working on? Right? Maybe there's a privacy issue that may have a security component, or vice versa. Right? Maybe it's a downtime that we didn't think was caused by something malicious, but maybe it is. Maybe there's some terms in a contract. I do that all the time where it's surprising. This is getting at the area that I want to talk to in general, which is we have to be. I said it before. We need to be more demanding of our third parties. Well, how do you know where to be more demanding? Review the contracts. I don't know if you're a CISO and you're not reviewing the terms of every vendor's agreement, all that bold stuff at the bottom, right? All they're doing is disclaiming responsibility for everything. I used to think that it was only a matter of time before there was a legal precedent-setting case where somebody had a breach that they could attribute to a vulnerability in a third-party solution, and they went after them to hold them accountable. And as soon as that happened, this was going to change everything in the industry. I still think that, except here's the problem. That case has already happened, but it didn't go to trial because the people involved knew that it would set a precedent that the industry didn't want to handle. So like malpractice lawsuits that get settled out of court because there's money involved. It takes that brave patient to say, no, I don't want the financial settlement after my family member died. I want to keep that doctor from doing it again. Well, nobody knows because when the settlement terms are, you can't even indict that doctor, right? There's nothing publicly about it. Well, it's the same thing here. I'm sure this has happened before, but whichever vendors were involved, we don't know about. So other people
Mm,
don't get the benefit of using it. We therefore need to be more demanding. Hospitals need to stop simply accepting at its face value whatever crazy terms our vendors because of a perceived imbalance in the bargaining power. I just reviewed one last week. They want a persistent VPN connection to their device. And if it's not maintained, we waive certain things to which we have a right. No, strike. It's, I mean, before we even engage that, once you've contracted with it, it's too late. Well, I don't know that legal counsel would have thought that that was a concern.
right,
I'm
right,
saying it's the word persistent that bothered me. Of
right,
course, we're going to rely on you to come in and issue patches and do updates, but I'm not leaving the door wide open
right, right,
persistently every hour of the day, just punching a hole in 443. We're going to have secure link. We're going to give you named accounts, and you're going to come in and you're going to integrate with our change management program. So when you do it, Matt, all of that's the right way to do it. That's us
right,
being more demanding. Because sometimes I said that to vendors and like, well, we don't support that. I'm not asking. I'm telling you that we are maturing as an industry. You have to participate. You have to anticipate when you sell something to a highly regulated. When I get a vendor that says you're the first CISO that's asked me about the security of the thing I'm selling you, really? You're selling to a, and then there's the one that we talked about that simulated our conversation. I won't name the company, but there's a product that is sold to the market today, and the embedded operating system is a 25-year-old operating system that went off support 15 years ago. And I shared with you that most CISOs, you can't give a hard no to things. You've got to have a yes, but. Well, I gave a hard no. It's the first hard no I've ever given. And because of that, we actually worked out another solution that meets the business needs. But there was no way I could defend acquiring today and putting to use a known vulnerable 25-year-old operating system. Shame on the vendor for not updating.
right. All right,
Uh,
Jason, listen, this has been incredible. And like I said, we could go for another hour and someday we will.
right?
But this was wonderful. So I think our audience is going to enjoy it. And I hope I can reach out to you again down the road and
Thank you.
catch up again.
My pleasure. I wish everybody a happy holidays. And as a reminder to the less experienced CISOs among us, the holiday time is unfortunately a time when bad actors know that we are understaffed. We have people that are enjoying PTO and celebrating the holidays. We cannot afford to let our guard down. Unfortunately, those phones and things are got to be tied to our hips so that we're aware. Because if you don't have everything in place, the single biggest strategy is to have early detection and effective response. And you being on call when other people are at home, that's just part of the job. So
Part of the job. All right, my friend. Thank you very much. We'll catch up again soon.
be well, Anthony.
Take
Take
care.
care. Talk to you.